Hello, and welcome to Getting Unstuck, a 7-part video series aimed at defining, understanding, and coping with depression. This is part 1, Defining Depression. It is recommended that you listen to each video in order to gain maximum benefit. And there will also be exercises and worksheets included along with the different sections, and those who complete those exercises also tend to gain maximum benefit from these videos. This workshop series is also not a replacement for therapy, so please contact the Drexel Counseling Center for more information about our services and to schedule an appointment. To begin understanding depression, it can be helpful first to define sadness and to differentiate between sadness and depression, as these terms are often used interchangeably but actually mean very different things. So first, we'll begin by defining sadness, which we define as a common painful response to challenging life events, with challenging life events meaning anything from the loss of a loved one, end of a romantic relationship, difficulties at school or work, anything like that. We can also experience sadness even while watching a movie or television program. Sadness can arise in any number of different situations. And sadness typically passes when that challenging event passes. So that also varies a little bit depending on the severity of the event. Obviously, we're going to feel sad longer if that challenging event is the loss of a loved one compared to something simpler like a less challenging event such as struggling in a specific class. Then the other important aspect to understand about sadness is that it's something we all experience at some point in our lives. Then to talk a little bit about depression, first, depression may or may not include feelings of sadness. So as I said, oftentimes we use depression as being synonymous with sadness, but someone can be depressed even without necessarily feeling sad. Depression is also a more persistent experience than just sadness. So as I said, sadness will typically pass when the challenging event passes. Depression can result from a challenging life experience, as I'll come back to in a second, but depression would typically last a lot longer than just sort of ending when that challenging event has passed. Depression also includes an entire cluster of symptoms that may or may not even include sadness, as I mentioned before, and we'll also come back in the next slide to understanding more of those symptoms, but it's important to understand that depression is more of a complex web of different experiences as compared to just the emotion of sadness. Then, finally, depression may or may not arise out of a painful experience. So this is important to know in the sense that a person might not be able to identify a specific reason for symptoms of depression. For some people, depression does come from a significant life event, such as the loss of a loved one. For others, it can seem to arise seemingly out of nowhere, and we'll come back to some of the other causes, such as like biology, brain chemistry, things like that. Okay, on this slide, we're going to be focused on more of the specific symptoms of depression. So I'm going to go through this table kind of one symptom at a time. Some are more self-explanatory than others, so I'll just be explaining a little bit of what's involved in each of the symptoms listed. And while listening to this, it can be helpful to just make note of any symptoms that are particularly prevalent for you, any that you resonate with you. Because the first goal of this workshop is really to gain a better understanding of what the experience of depression is like for you in particular. Okay, so we'll start at the top left and I'll just go down one column at a time. So first, self-criticism, common in a variety of different issues, but in depression, self-criticism a lot of times looks like thoughts regarding not being worthwhile, could be about like being socially awkward or people not liking you or just not succeeding academically or in any other important area of your life. Then next, withdrawing from friends, family, pets. Withdrawal is really like one of the most common depressive symptoms. So withdrawing from anything in your life that is typically important to you is an important symptom to understand of depression. Then next, changes to sex drive. This primarily for most people, it manifests in a lack of interest in sex. Then changes to eating or weight. In this area, changes happen in different directions for different people. So some people might eat more than usual and thus gain weight. Other people will find like a lack of appetite, thus eating less, potentially losing weight. Next, unexplained aches and pains. These can manifest in really any area of your body. And some people will report just feeling sort of like this constant pain that can't really be explained by anything else. Then next symptom, physical restlessness or slowing. So this one's similar to the eating and weight, kind of goes in either direction. So restlessness would be like feeling like you can't sit still. And physical slowing is more like moving more slowly than what's typical for you, or speaking more slowly than what's typical for you. And a lot of people will describe that physical slowing as a sensation of moving through molasses or moving through mud. So it's kind of like your body is heavy. Next symptom is helplessness, which essentially means this idea of there's nothing I can do to make my situation better. Then moving on to the next column, so reduced focus and concentration. This can be in a variety of different areas, but a lot of people will describe difficulties with just staying focused on like schoolwork and academics, and just that they don't feel as focused as they typically would feel. And so it just becomes harder to get work done. Next symptom, suicidal thoughts or preoccupation with death. So again, this can manifest differently for different people. So suicidal thoughts obviously would be thoughts of wanting to die. Then preoccupation with death, again, can include suicidal thoughts, but preoccupation with death can be thoughts of not necessarily wanting to die yourself, but just thinking about death more than what you did prior. Then poor hygiene kind of connects to low motivation. So a lot of people with depression will struggle to maintain a daily hygiene ritual, such as showering, brushing teeth, things like that. Worry about something awful happening. This kind of manifests in a bit of the overlap between depression and anxiety. So worry about something awful happening a lot of times happens in anxiety, but in depression, the same worries can come about just from a lot of people will spend their time while depressed sort of lying in bed or just withdrawing from other things of their life and spending time with their own thoughts, and this can lead to thoughts of how things might go wrong in the future. Then numbness or emptiness, or feelings of emptiness, So numbness and feelings of emptiness kind of, for some people, like we were saying before, they might experience feeling sad a lot of the time. Other people will describe it as if they're feeling nothing or just feeling numb. Heaviness in the body kind of relates back to that idea of the physical slowing. So that, as I mentioned before, feeling like you're moving through molasses or mud, so your body kind of feels heavy. Loss of pleasure for things you used to enjoy. This is one symptom that we'll be talking about a lot throughout the course of this workshop. It's one of the primary symptoms that can lead to a lot of that withdrawal, in the sense that things you would usually enjoy just don't feel as enjoyable anymore, so a lot of people will stop doing those things. And then when you stop doing those things, it can create a whole host of other issues. Next column, low mood, persistent sadness, pretty self-explanatory. Crying spells, again, kind of goes back into that. Anger or irritability, again, another emotional manifestation of depression aside from sadness. Same goes for the next item of guilt or shame, just as we're reflecting on all the things we either don't like about ourselves or don't like that we did. Guilt and shame can come up in addition to the irritability, anger, crying, sadness, everything else. Then increased or reduced sleep, similar to the what we talked about with eating and weight and the physical restlessness or slowing. Sleep can change in either direction. Some people with depression will report not being able to sleep. Others have issues of sleeping a lot more than they used to. Then hopelessness, a lot of times can relate to helplessness. It's a little bit different. So with helplessness, it's like I said, that idea of I can't do anything to fix my situation, and hopelessness is more projecting that into the future and saying my situation will never get better. Inability to make decisions or just difficulty making decisions is another component to depression, and this can be both big decisions like life decisions of what do I want to major in, and it can also be little decisions that people with depression will talk about, like going to a restaurant, looking at items on the menu and just not knowing what they would want to eat. Next column, fatigue or low energy, pretty self-explanatory, and one that we often associate with feeling sad. Suicide attempts, again, so related to suicidal thoughts. Suicide attempts can be another depressive symptom. Self-medicating with alcohol or other drugs, again, pretty self-explanatory, I think. It's not uncommon for people with depression to, in an attempt to feel better, to use alcohol or other drugs. Appetite disruption, we already kind of talked about. I talked about it in the sense of changes to eating or weight. So if your appetite is reduced, you probably will eat less. If your appetite increases, you might eat more. Gastrointestinal problems, I would relate this to the unexplained aches and pains. Sometimes a lot of people have just gastrointestinal pain and then gastrointestinal problems of like increased issues in that area. Then fear of rejection, pretty self-explanatory again, and trouble with memory. This is probably not quite as severe as what we may think when we see trouble with memory, but this can be just like short-term things that a lot of times manifest because people are just distracted with their own inner world of the thoughts about things they're upset about to really take in what's happening around them, and so then they won't be able to remember those things later on. Finally, for this module, we're going to talk a little bit about how all these symptoms exist together and how they can manifest in sort of a downward spiral of depression. So in this case, we'll start at the top with that kind of like purple box and see how one thing leads to another and different areas, different symptoms all kind of build together. So in this example, start with just receiving a bad grade on an exam. And when that happens, the person in question starts to feel sad and irritable, which again, when we talked about the difference between sadness and depression, feeling sad in response to a life event, such as getting a bad grade on an exam, is completely common, normal. Most people will have that experience of just not being happy about getting a bad grade on an exam. What can happen in depression is that feeling sad and irritable about the bad grade can lead to thoughts such as, I'm a failure, which can lead to increased feelings of fear, some feelings of hopelessness. So fear in the sense that am I going to get more bad grades in the future, and hopelessness of sort of like more of a certainty I am going to get bad grades in the future and I'm going to fail out of school, and it kind of goes downhill from there. And then after that fear and hopelessness and thoughts like I'm a failure, a person might start to experience other symptoms like losing their appetite, feeling tired, but still feeling that they can't sleep, lying in bed, and thinking about how they're going to fail out of school, again, kind of relating back to that hopelessness. So to me, this downward spiral can again illustrate a bit of the difference between a more common sad experience and a depressed experience, where in sadness it might stop at the bad grade in the exam and you feel sad about it. With depression, it can lead to more hopelessness, fear, thoughts like I'm a failure, then lead to other symptoms like losing your appetite, feeling tired but not being able to sleep, and spending a lot of time just lying in bed thinking about failing out of school. So instead of stopping at just the sadness, it kind of spirals to a point of lying in bed thinking about failing out of school. So while lying in bed, you're not doing other things that are important to you, like seeing friends, and you're getting those other symptoms too, like the hopelessness, the lost appetite, and the fatigue. So that's it for Module 1. In Module 2, we will return to this idea of the varied symptoms of depression and talk about a specific model of how we might understand depression. And through that model, gain sort of a better understanding of where these different symptoms come from, how they work together, and how they kind of keep us stuck while we work towards the goal of this workshop of getting unstuck. So I'll see you in Module number 2.